Hi, everyone. Thank you very much, Ruben, and also thank you very much, Emerson. So, and a big thank you to Dr. Jimmy for his sharing. And I'd like to welcome all our doctors in attendance tonight. And there's a huge, this is actually, wow, a fantastic number of attendees tonight. This is a very big attendance, actually. And I hope you're all excited to explore today's topic, which is PPARs for cancer protocols, all right? Before I begin, I would really like to continue to ask a few more polls. Please understand that these polls are not meant to annoy or frustrate all the attendees. These polls are specifically asked so that I can right now begin to tailor my presentation for all of the attendees tonight. I hope to finish my part of the presentation in about 30 minutes. Yeah, if I can finish it in less than half an hour, I think everybody would appreciate that. And also that will also free us up for really questions. I'm sure all the doctors in attendance tonight are very well read. And I think what we really want to do is just cover the gist of it and then open up the panel for questions, which would really help you. You know, questions like what are some examples of protocols, or specific questions on applications of the protocols, or even how you could work together with SimplyNature. So without further ado, Noel, Mr. Noel, can you put up the next poll so that we can get some clarity? Okay, so this one is really simple, all right? In order to keep the presentation short tonight, which would you rather I focus on? Chemotherapy support, or you want to really know the natural action of PPARs on the treatment of cancer? These two are actually slightly different. It depends on in attendance what you want for your practice, right? So whether you want to take on more chemo patients while working with your oncologist, or are you more specialized in, for example, you are in integrative medicine, you are treating patients in stage 1, stage 2 cancer patients, or patients who have already exhausted chemotherapy and are looking for alternative. Or of course, there's the possibility that you are treating certain patients, for example, geriatric patients who are slightly older, who want to avoid chemotherapy because they just want quality of life. There are many possibilities, but please let me know which would you rather me focus on, all right? Okay, next, can we go to the next poll? Is there any more polls? Yeah, I just wanted to check. And also, yes, okay. This one is just a yes/no question, very easy. Would you agree that having an adjunct therapy that addresses side effects can increase compliance rates? All right, this is more specifically for oncologists, right? That if we can reduce the side effects of chemotherapy, as Dr. Jimmy has shared with his patients, the compliance actually goes up. That means patients actually continue with the chemotherapy. All right. Noel, can you actually show me the results of poll number 5 now? The one about where the audience wants to focus. Oh, it's 50-50. Okay, it's 50-50. Really? Half-half. Okay, so I will split my time. Okay, I think let's go to the next poll. Okay, just about 2 more, and then I'll be very clear what we would like to cover tonight. Are you attending to cancer patients tonight? All right, so that's a very easy one. Okay, so I'd just like to know, because if there are many doctors who are attending to cancer patients tonight, I will cut short on the theoretical or the presentation, and I will open more to Q&A, because I'm sure if you have cancer patients, me answering your questions will be more helpful to you. All right, next poll number 4, and that's the last poll if I'm not wrong. Okay, what treatment course do you usually prescribe to your patients? Now, this might change after tonight, right? It might change after tonight. So as Dr. Jimmy said, I love what Dr. Jimmy ended his interview with Emma on, which is, as medical practitioners, it's so important to continue learning. It's so important to continue learning. Even myself, I work with a lot of conventional medicine doctors, but me and my wife are actually embarking on a TCM journey at this point of our life, simply because in the treatment of cancer, we really want to be patient-centric, and we really want to understand things that seemed weird or things that don't make sense to us in the past. But right now, we really want to get to the root of the thing and try to understand from different perspectives. Because right now, patients are also being more selective. They are reading up a lot more. And it's very hard to argue with results. When patients see some of their friends getting positive results from other protocols, they would come and ask their doctors, their uncles or integrative doctors, and they would like to know how and why. So even myself, even though I'm well-versed in PPARs and more conventional in approach, I'm also embarking on personally on a TCM journey, just so that I can, like what Dr. Jimmy says, continually learn, to make sure we can always stay patient-centric, all right? Okay, Noel, do you mind showing me all the results of the polls? Just, it's fine to flash out. Okay, not everybody answered everything. Okay, yeah. All right, 100% next, poll number 2. Okay, yes. Okay, poll number 3. Okay, I just saw less than about 20% of people answered the polls. Okay, this one. All right. Okay. Okay. Good. Good. Okay. So yes and no. So that means there are doctors and attendees right now. Oh wow! I like this. I'm so happy that today we actually have practitioners who are combining two. That means we are really starting to practice integrative medicine. Okay, so I have a great idea on how we can proceed tonight. So without further ado, the time is 7:50 now. I will aim to finish my short presentation by 8:20, and then we can have Q&A, and I hope that this will be an exciting time for everyone. All right, I'm gonna share screen right now. Okay, I hope everybody can follow me. Everybody's okay? Let me check on the chat. I'm just pulling the chat screen up so that I can see your responses. All right. Okay, if everybody is still there with me, just indulge me in a moment. Just type 1 or say yay or good evening to everyone, so that we get some interaction, right? I don't want this to be a one-way. All right. So it's a Friday evening, I think first thing I want to type is TGIF. Thank God it's Friday. Okay, let me see. Is there an option to everyone, hosts and panelists? Okay, all right, yeah, all right, okay. Let's jump right in. All right, first slide I want to show you is these are our products from SimplyNature, and I'll be talking about PPARs, all right, tonight, the mechanism. So Dr. Jimmy said about tablets, which is actually what you see there, PPAR Plus tablets. These are the raw whole food, plant-based whole foods, all right? I will talk a little bit about that, probably about 3 minutes about that. But what is important is on the bottom, you can see this PPAR box here. This is a liquid extract. That's very important for stage 3 and 4 cancer patients, all right? And this is our PPAR powder, same as this extract, less concentrated, all right, but still very important is what you can do to maintain the high dosage. Soft gel capsule, this is a first go-to for any patient that's going for chemotherapy. That means you don't have, depending on the strategy and of course the financial strength of the patient, this is the first go-to. If a patient is going for chemotherapy, you start the patient on tablets and soft gels, and then you watch and see, right? If the patient does well, very little side effects, this is fine. But if let's say that the patient starts to develop any side effects from their radiation therapy and chemotherapy, that's when you go up to the liquid extract, which is a lot more powerful, concentrated, and effective. Once the patient's condition start to stabilize and improve, you have the option to either keep the patient on the liquid extract or to go back down to the soft gel. So depending on the patient's financial strength, because as we all know, the limitation of cancer treatment is often limited based on patient's financial status, right? So if the patient can, more wealthy patients or patients who are very committed, they often stay on the liquid throughout their chemotherapy period. but for patients who have financial challenges, they use the liquid extract during more difficult chemotherapy sessions. And when they are okay, when they are stabilized, they use the soft gel capsule to really see them through the regular days. Okay, so these are some possible combinations. Okay, so our topic today is PPARs, peroxisome proliferator activator receptors. Okay, so what is this? PPARs, if I could draw an analogy, PPARs is like steroids when steroids was first discovered. As doctors, you are well familiar that the application of steroids is tremendous. It's being used in many different fields, right? In many applications, steroids. So it's the same for PPARs as well. These are the standard 40 over illnesses that PPAR is being researched for, not by nutraceutical companies, but by pharmaceutical companies. So PPARs is actually the target of pharmaceutical research for the development of conventional drugs. All right, so there are more than 50,000 published research articles on PPARs, and this can be seen on, like, for example, you just go PubMed, you search PPARs, and straight away already 27,675 results, right? So if you go across different publications like Hindawi, you will find that thousands and thousands. And you see this one is published 2020, October 28, right? So there are actually articles published in 2021. In fact, our company published, our associated company published in 2021, one that I'm going to show you later. Okay, before we go any further, taking a look, all right, to give everybody an overview, because as we talk about the protocols, it will be important to know the method of action so that as doctors, you are able to tailor the protocol or at least understand how it will work with your current protocols, okay? Now, one thing that is very good about our product is that our product is a natural food-based product. Okay, it is not an herb. It is not lingzi or ginseng. So the difference between herbs and food is that herbs have medicinal properties, but anything that has medicinal properties also have the potential to be toxic. All right, it has the potential to be toxic. Okay, so in reverse, in contrast, all right, foods are like, for example, oranges, blueberries. Blueberries are not considered to have medicinal properties. They are high in antioxidants that support body functions, right? So these are food-based. They are not medicinal in nature. So our product, SimplyNature's PPAR series, is a concentrate of food-based. It's coming from a food base and not from an herb base. Now, this means that it is absolutely safe for you to adjust dosages beyond and above our initial recommendations, all right? And we have done an LD50 test. The last time I presented last month to a cancer center, the doctors that were, the oncologists that were in attendance for the forum at the cancer center were so happy because we did an LD50 test, which means it's a lethal dosage 50 times 50 tests, all right? So it proves that our product does not have a toxicity level, even if you take immense amounts of it, all right? Okay. Now, as you can see, PPARs, imagine if you are a patient and a client, right? You just Googled, I just Googled this before the presentation. I just type in PubMed PPARs cancer. And the first few things that come up that people ask is, people also ask, can PPARs cure cancer? And here you can already see PPAR alpha and antagonists can be effective therapeutic option for treating cancer. So this explains what we already know, that PPARs as a molecule, all right, is what is being targeted by pharmaceutical research for many applications, the 40 that you see over here. All right, you can see here is a lot of it is metabolic. So we know that metabolic syndromes is the root of developing cancer in later stages, right? You start with metabolic syndromes and over time it becomes cancer, okay? Now, I want to talk about how our product actually works. So for the next 5 minutes, we are going to have a review, Okay, this will really go into the nuts and bolts of how our products actually work. What is the mode of mechanism? And this is a very important topic right now to introduce at this point, which is epigenetics. Okay, we can't talk about how PPAR works without touching this topic of epigenetics. So basically, genes can be switched on and off. Now, it is now proven, and it's definitely the very exciting field of study, especially for the field of nutrition and nutrition-related disciplines. For example, for medical doctors, that would include lifestyle medicine, the practice of lifestyle medicine, which is basically nutrition at MD level, right? Now, to talk about this, I'm just going to go some very basic things. Please pardon the scribbling. I actually cut and paste this from my own notepad. You know, when I do my doodle, when I was doing my research and clearing up my thoughts. So this is just a review of DNA, right? In the cell, DNA never leaves the nucleus of the cell. In fact, there is the transcription factor where DNA becomes RNA, and then RNA becomes protein as a translation. So that's just a biology refresher, right? Molecular biology, transcription and translation. So RNA leaves the nucleus through the nucleus pore to the cytoplasm where protein synthesis takes place. Okay, this is exactly where our COVID-19 mRNA technology is being applied. The mRNA technology basically is a transcription factor, right? And we use that to actually produce a version of the virus or teach our immune system how to recognize the COVID virus. This is also the technology that hopefully over the next decade or more, they want to use this tech to actually vaccinate people against cancer, right? It's the same concept by teaching by affecting the mRNA or RNA, the transcription factors, that you will then teach your immune system to recognize cancer cells. And this, in essence, is how immunotherapy currently works, right? Immunotherapy drugs, to simplify it, and I hope I'm not oversimplifying it, but it basically teaches your immune system how to recognize cancer cells. And that's how immunotherapy, a large portion of immunotherapy drugs work. Now, that also highlights that in order for immunotherapy to work very well, the patient's own immune system must be working as well. So if you teach the immune system how to recognize, for example, a particular strain of breast cancer, what's the drug? Herceptin, I think, Herceptin, immunotherapy drug. But if your immune system is compromised, then it doesn't work as well. So this also ties into how SimplyNature PPAR protocols can actually strengthen the immune system and then make immunotherapy more effective, all right? Okay, we go down. Okay, here it is. PPARs, activator receptors, all right, nuclear receptor proteins that function as transcription factors, regulating the expression of genes. So really, we are actually modulators that help to regulate a few genetic pathways, and that has a tremendous impact on the patient when it comes to cancer. Okay, a little bit of history. This was first discovered in 1960, but it was only until the 1980s that it was started to become more formalized, right? And it's been 40 years. 40 years, it finally now is very prominent in the area of research. Yeah, okay. Now, here it is. What in essence is PPARs? PPARs is basically a gene activator. It can be activated with ligands, which is what our protocols are. Our protocols, how we activate PPAR receptors, is that our products, our extracts contain ligands that are agonists for PPAR receptors. Okay, and our ligands are natural fatty acids and fatty acid derivatives. Okay, so yeah, so basically, in a sense, we are very much like a natural immunotherapy drug, but it works together with immunotherapy. So for the oncologists in attendance tonight, you don't have to worry that this is a replacement. No, it's not. It's a synergistical. Always remember this, right? For both the integrative medicine practitioners that are joining us tonight, as well as conventional doctors, one would always advocate that if you are taking a flu medication, you should also make sure you take in sufficient fluids, right? And it will be encouraging. Doctors will definitely encourage you to take more vitamin C via oranges or maybe just supplements. So it's not an either or thing. It's really you have the drug version where you're boosting your immune system, but you also have natural things that you should be taking as part of your dietary food strategy that will support and stimulate and to actually activate these pathways in your body. So when the two come together, you will see good results, right? Okay. So PPARs is important in the modulation of numerous gene pathways. It basically epigenetically interacts with other proteins. Example, anti-inflammatory action by attenuating NF-kappa B signaling. So we get a little bit technical here, right? But I'm just gonna show you, like, for example, these are some of my personal notes, like PPARs alpha, it regulates serum lipid homeostasis. It's a transcription of fatty acids catabolizing enzymes is increased. That's why HDL is expression actually increases, and then mitochondrial oxidation regulation, right? So this is this will show you why our products affect the metabolic pathway and why it has good results with things like blood cholesterol, blood sugar management. In fact, PPAR-based drugs are used in combination with conventional diabetes drugs. For example, Actos and Avandia, before these particular drugs were withdrawn because of the side effects of the artificial ligands, it caused heart palpitations. But the method of action was that it actually synergized with metformin. And it's true for our products as well. So if you take SimplyNature PPARs, metformin actually works even better. And that allows physicians to modulate or to adjust because patients want to get off their maintenance meds because it affects other aspects of their health, right? So these are some options. So PPAR gamma, what does it affect? It affects adipose tissue. It's the main target of PPARs gamma. It promotes terminal differentiation of adipocytes, inhibits tumor genesis. Okay, as you can see here, PPAR affects the pathway for cell delineation. This is really impactful on cancer patients. Why? Because almost all chemotherapy and radiation therapy affects bone marrows. So bone marrow, that's why whenever a patient starts on chemotherapy, their red blood cell count and white blood cell count is always monitored, because across the board, drugs like cisplatin and other platinum-based chemotherapy drugs will affect the bone marrow, and that affects the patient's red blood cells and white blood cells. And of course, that is the basis of your immune system as well, and that will compromise any immunotherapy that you might want to do later. So when a patient takes our PPAR protocols, this actually helps the maturation of your blood cells, all right, in your bone marrow. Your bone marrow cell stem cells will actually maturate properly to become red blood cells and white blood cells. So it's very common that patients who take SimplyNature PPARs, especially the extracts, will see a normalization or an increase for many cancer patients because their RBCs and the WBCs counts are low. So the moment you take SimplyNature PPAR extracts, all these RBCs, WBC counts start to increase. Why? So the method of action is now very clear because it helps in cellular differentiation, right? So the maturation of stem cells in your bone marrow to become red blood cells, white blood cells is actually a more effective way. You don't end up with deformed blood cells, which results in low counts of RBC and white blood cells. Okay, so that's the theory part. I hope you enjoyed this brief back to school feeling, okay, where we are all become slightly more academic. But like right now, I like to move to the first part. which is how our protocols can work together with cancer patients. I think I can cover this in quickly about 4 minutes. Then I will talk about the next part of how our protocols can help if you want to treat cancer patients who are not able to avail themselves to conventional medicine protocols. Okay, number one, chemotherapy is very important. You know, I would say 5 years ago, I am not much of an advocate of chemotherapy because I have cancer patients in my own family, and you know, and I know many oncologists as well. It's one thing when you're treating your patients, it's another thing when it's a family member, right? That's why it's always harder that's why surgeons don't operate on their own family members. So here is one thing. So 5 years ago, I would say that I'm not an advocate of chemotherapy simply because I saw the side effects it had on people I cared about. But there is one very important thing that we all have to acknowledge is that chemotherapy is very effective for the killing of cancer cells. Now, what is the drawback or concern about chemotherapy? And that's how I first met Dr. Jimmy, and we became friends and started to exchange ideas, is this: if we can mitigate or remove a majority of the worst parts or the worst side effects of chemotherapy, then chemotherapy becomes a very attractive tool or medication or treatment protocol for cancer patients, right? If you can remove the side effects of chemotherapy, then chemotherapy is a very powerful and effective tool to kill cancer cells. And most chemotherapy patients, about 30% of them actually drop out of chemotherapy because of the side effects. So if we can address this issue, it will be great for the oncologists, right? Because then their patients can stay on the chemotherapy prescribed. Now, it also means there's a lot of opportunity for the non-oncologists in our audience today. Because if you would like to go into cancer support and cancer treatment and, you know, not clash, right? Not clash with your fellow medical colleagues, okay, the oncologists, then our protocols will put you in a very good position. You can actually treat and support the cancer patients while they're going through their chemotherapy. So you don't have to come from an opposing viewpoint from oncologists. You can work with your medical colleagues because we can work to support and remove the side effects of chemotherapy, and that will be good for the cancer patients. Okay, so these are just some data. Basically about side effects: nausea, loss of appetite, dry mouth, hair loss, numbness, fatigue. You can see the incidence rates are very high, 86%, right? 65%, 76%, 60%, 83%. So it's like basically what we are saying is if you're going for chemotherapy, you're not going to feel good. All right. In fact, you're going to feel terrible. We will share protocols with you in the next 3 minutes on how we can address all these issues. Okay, so everything I say from this point is actually from published journals. So we have actually worked with top researchers in the field. This is the National Health Research Institute of Taiwan, and we have published all these results in all the publications that you should be familiar with. For example, the Wiley, Hindawi. Okay, these are all something that you're all familiar with. I'm going to highlight a few key things to take note of from our published journals that I think will be of interest to everyone. Okay, first is this one. So here it is. Our extract prevents cisplatin-induced myelotoxicity in vitro and in vivo. All right, so this is just great, right? This is exactly evidence-based, straight addressing the issue of cytotoxicity. Basically, in this report, we show that when you interact cisplatin, which is a platinum-based chemotherapy drug, and is used for at least 14 different types of cancer. So one of the most common use is, I believe it's prostate, colon cancer, and breast cancer. Okay, the very common ones. Okay, so this means that it's not a theory, it's not, it is direct application. We applied the chemotherapy drug to our product on bone marrow cells. And this is what happens, all right? Okay. This is LD50, just to prove that we have done that. And this is the results from LD50. So basically, there's no such thing as overdosing on our protocols and developing toxicity. So I hope that gives comfort to all the doctors here that we have SimplyNature has gone above and beyond what you would expect a natural supplement to do when it comes to product safety, especially for patients, okay? So we have no contraindications with all the standard protocols and all the known protocols over the years. We are FDA approved, food-based, no contraindications, effective for egg jump and primary nutritional support, pre-concurrent and post-oncological protocols. So as Dr. Jimmy said also, he uses our protocols to prepare patients for surgery, not only oncological surgeries, but even normal surgeries in general. Okay, so what is the key benefit? It protects the bone marrow and spleen against cytotoxicity. It reduces inflammation. This is really important because all forms of conventional protocols for treatment of cancer will create huge amount of inflammation in the body. You can just imagine chemotherapy drugs going through the body. You can just imagine when a body is being exposed to radiation therapy, inflammation is a huge issue. SimplyNature PPAR protocols modulate the anti-inflammatory response. So this is why patients feel much better and recover much faster, all right? So here's a point where it's very interesting. PPAR agonist actually enhances cancer cell chemotherapy sensitivity, right? So that means that patients who take PPARs, there are chemotherapy drugs, for certain chemotherapy drugs, it works even better. So it literally sensitizes the cancer cells to be affected by chemotherapy drugs. So I hope all those oncologists who are joining us tonight, you will be very encouraged and you will find it very exciting, right? That you have a protocol that can not only manage your side effects, but actually improve the outcome for your patients. And of course, if your patients feel well, they don't drop out. Okay, so here is a quick overview. So co-treatment is when taking SimplyNature PPAR extract liquid together with chemotherapy. You will see that the weight loss is the same as control, the same as not taking chemotherapy, right? Now, the pink line is the chemotherapy drug. In this case, it's actually oxaliplatin, which is like cisplatin, a platinum-based chemotherapy drug. So you can see that normally within like 4 days, a patient can lose 10% of their weight. So this is why you can see a person like lose 10 pounds, right? Just in 4 days. But with our co-treatment, that means taking SimplyNature extracts, you will find that the patient's body weight stays the same. So this is really very encouraging for cancer patients who are so scared of taking chemotherapy. But once they start with chemotherapy and our product and they say, oh, wow, I don't have all the side effects that I heard about, the horror stories, this makes them very confident. They feel good, they are confident to go and continue with their chemotherapy sessions. For the non-oncologists that are listening tonight, I think this is very exciting. Imagine a patient that's preparing to go for chemotherapy. You don't have to persuade them otherwise. You can confidently tell them, I'm going to walk with you. I'm going to support you through your chemotherapy. And you know, when you go to your next chemotherapy session, you will see other patients looking frail, but you will not. You know, under my care, you will still feel energetic, your face will be rosy, and you will look good. And that's actually the common comment that comes back to our doctors when their patients say, you know, doc, when I go to the hospital for my for my chemotherapy, everybody keeps asking me, how come I don't look like I'm taking chemotherapy? So that's some of Dr. Jimmy's patients actually share that they're asking, are you taking something else? How come you don't look like me? How come you don't feel so sick like me? So for the non-oncologists in attendance tonight, you know, this is one area you could actually end while they follow their oncologist, right? So that's good news. Okay. Now let's just take a look at the real action. Okay, this is what happens, right? You see the bone marrow before chemotherapy, and on the right, you see the bone marrow after chemotherapy. So this is the reason why, you know, chemotherapy is why red blood cell counts, WBC counts drop, okay? Your bone marrow really gets destroyed, okay? Now, you will see at the bottom here, this is what happens when you take oxaliplatin together with SimplyNature liquid extract, you can see the bone marrow stays intact. Okay, it stays intact. Now let's take a look at another one. This is for cisplatin. So on top here, this is the bone marrow control. That means the bone marrow on its own. This is the bone marrow when you put cisplatin chemotherapy drugs. So you, as we all suspected, right? Chemotherapy, destroys the healthy cells. So this is what happens. Now, this is what happens when you take cisplatin together with our SimplyNature liquid extract. You can see the bone marrow, it stays intact pretty much like a normal healthy bone marrow. So that means the worst part, the things that's scary about chemotherapy is actually being managed. It's actually being managed. You can imagine how the patient will feel, how they will go through. And I'm going to prove it to you by taking a look at this slide. This is Dominic. This is actually Sheila's son, our first host that introduced everybody, that introduced Mr. Emerson. And that's why she joined SimplyNature, because she's a direct beneficiary of our protocols. This is her son before chemotherapy. This is not after, this is before chemotherapy, and this is after chemotherapy. This is before chemotherapy, this is after chemotherapy. Most of the time, it's reversed. Usually the picture is this is before chemotherapy and this is after chemotherapy. But on SimplyNature, it's actually this is before chemotherapy and this is after chemotherapy. So you get to see how effective our protocols are. And this is, Dominic actually went through 38 sessions because, as we know, for children who have cancer, because children are growing, okay, they're in their growing stage of their life. So it's actually you have to go through many sessions because the cancer also benefits from the growth stage of a child. So the cancer is kind of very resilient as well. But on the positive side, children have a very high success rate if they are able to survive the chemotherapy sessions. All right. So this is Dominic. You can see after 2 sessions, there was a period of time for 4 sessions, which is about a little bit more than a month. He was not on our extracts. So the moment Dominic went off the extracts, you can see how he lost weight. Now, after that, he went back on the extract and continued 12 sessions of chemotherapy after. You can see Dominic actually put back weight again, and this is Dominic 1 year later, okay, and this is Dominic now. The good news is I think he finally removed his tracheal implant. All right, this is another one of our patients. This is Dr. Johnson's patient. She was on tamoxifen and Xeloda. Okay, she is fourth stage breast cancer with bone metastasis, usually very painful. But right now, she actually was able to continue a chemotherapy session. She actually wanted to stop after 2 sessions, but when she went back on the protocol, she felt so good that she could go back on chemotherapy. And that's actually important because she's not first stage. She's metastasized to the bone. So you really need to do something. You can't just go all natural. It's not so easy, right? And this is so good. And she's still doing well even up to today, all right? So she was bedridden. She became thin and weak. She was in pain all day and night. And after, she can now stand, no hair loss and no side effects from her chemotherapy, okay? So this is some of the results. So again, we have results. This, I think, could be Dr. Jimmy's patient, but you can see the improvement after 2 months. This is combination of chemotherapy and our protocols, all right? So you can see, wow, what fantastic results, right? Okay, so this is the benefit of integrative approach using both conventional and nutritional support. And for all the oncos tonight and those who hope to work with oncos, or at least work together with conventional protocols and not say go an alternative, I hope I've given you a glimpse of what you can develop in your practice, how you can practice, right? And this is all evidence-based. And tonight, I gave you a general idea of what's that called, of how the product works, the mechanisms behind it, okay? Now, I'm gonna move next to what happens when patients have to or choose to want to go natural and avoid oncological protocols. There are many reasons why this could happen. Number one, if you end up with older patients, right? For older patients, maybe because of their age, they rather not. They rather want to have, leave it to God, right? Go all natural. If I'm to be healed, I'll be healed. If not, no. Then for other people, it could be other reasons why taking on chemotherapy will be challenging and difficult for them. And there are others who simply choose to want to not go for conventional medicine. So how does SimplyNature PPAR protocol fit into a patient like that? Okay, in order to understand how we work, how we can help a patient, let's understand the overall strategy. How would you go about fighting cancer, right? What's an effective way you go about fighting cancer? So if you will take a look at the slide, the green words here, it says direct attack. Okay, so direct attack is really one way we treat cancer. And this is basically surgery, chemotherapy, right? You directly attack the tumor by cutting it out, by using chemical drugs to attack the cancer cells. Now, naturally, we also have a direct attack. Our immune system is a direct attack on the cancer cells. So how does SimplyNature PPAR extracts work? Mr. Emerson can send you the journals, so I won't go into detail about that. I'll just give you the understanding. We increase dendritic cell activity, right? So by increasing dendritic cell activity, we do what immunotherapy drugs do. Okay? But we don't do it for the body. We facilitate the body system to do it better or to do it well. So we increase the dendritic cell activity. So the dendritic cells are responsible for identifying the cancer cells. Okay, so that's the first step. Our products were genetically, remember we covered right in the beginning of my talk, that is an epigenetic. So it starts the genetic pathway, it triggers the process. And the science behind it is basically the maturation of dendritic cells. All right. Basically, you are then able to identify the cancer cells better. And if you identify the cancer cells better, then the next thing, which are your macrophage cell activity and your natural killer cell activities, if they are also boosted, they can go after and attack the cancer cells. So basically, you end up with a form of natural immunotherapy. You really activate your immune system to both identify and attack the cancer cells. Okay. The next strategy in cancer management is how do you starve the cancer cells, right? How do you prevent the cancer cells from growing rapidly? So basically, you want to control two things, right? You want to control inflammation, and related to why you want to control inflammation is because you want to prevent angiogenesis, diba? So you want to prevent the formation of blood vessels that will rapidly increase the growth of the tumor. So you can actually do that because our PPARs modulates the anti-inflammatory response. So it will make the environment, the body, chronic inflammation and specific inflammation as a result of cancer, right, to actually calm down. So when you reduce inflammation, you make it hard for angiogenesis. So you make it harder for the tumors to grow their own blood vessels. So you are arresting the growth of the tumors. So that's the second strategy and the third strategy and fifth, basically all lumped together, right? You want to control inflammation because you want to starve the cancer cells. And then on the other side, you directly attack the cancer cells. And of course, the fourth one is you want to prevent the cancer cells from breaking off and spreading. Okay, so one of the benefits or the side effects of side benefits of PPAR activation is that it increases cell cohesion. Okay, so literally your cancer tumors will be more cohesive. So there is a lessening, all right, of the chances of it breaking off, entering the bloodstream and traveling to another part of the body. So basically you are trying to minimize metastasis, okay? Okay, to support everything I've shared, these are the charts behind it. This is how the dendritic cell maturation, all right? So you have cell-mediated immunity, all right, antibody-mediated immunity. This is the technical aspects, all right? This is just some charts on dosaging, which if anybody asks later, I will refer back to this. Okay, this is another one, is to show, okay, the effect on hepatoma, which is, I believe, liver cancer cells, right? So on the left, you see triglitazone. This is a synthetic PPAR drug, okay, synthetic PPAR drug, okay. On the right, you see our SimplyNature extracts. This, we just want to highlight to you that this is a drug on the left, and on the right is our SimplyNature. So you will notice that both the drug and SimplyNature extracts have similar effects. What does this mean? That means that you have a natural alternative to what you want to be achieved through drugs. Okay, these charts simply prove without any doubt that our product actually has effect. What kind of effect? The same effect that you're trying to achieve with drugs. Now, why is this useful? This is very useful, both even for oncologists, because if patients are not able to take certain drugs, now you have a natural alternative. All right, and like I said, patients may choose to not take drugs for numerous reasons. This is also another thing that shows you that SimplyNature protocols actually inhibit. This is, I believe, lung cancer. Is this our liver cancer one? Okay, I believe this is still liver cancer cells, okay, transplanted onto the mouse, okay? And you can see the growth is much smaller when they are on our PPAR protocol. Last but not least, for all cancer patients and for doctors supporting cancer patients, naturally, nutrition is a very important part. So our products are basically made from natural microalgae, and microalgae are superfoods. All right, so 1 gram of microalgae will be almost equivalent to one cup of vegetables. Okay, that's how concentrated nutritionally microalgae are. And this is just an overview. It's not a comprehensive list of the nutrition available in our tablets, but you can see it's 60% plant protein. Dr. Jimmy talked a bit about that. But you know, of course, if you're only taking 2 grams of our product, you don't get enough protein, right? Even if it's 60%. Right? But what I want to highlight is not actually just the protein, but you know, the vitamins and minerals that are so important in all the bodily functions. Okay. So basically, I've come to the end of my presentation. I hope I've given you enough seed to ask questions in the next segment, which we will start, which is the Q&A segment. I do want to highlight to everyone as well, the treatment of cancer is very important that liver functions, kidney functions, lung functions are maintained. Okay, so if patient is undergoing chemotherapy or any other natural protocols, if the liver, kidney, and lungs are not functioning well, all right, it makes it very difficult and it complicates the patient's fight against cancer. So our products, even before we used it for cancer, they were used for metabolic syndrome. So we are proven to be able to help manage blood cholesterol, blood sugar, chronic inflammation. Again, this is not just us stating these facts. If you want to know the method of action, we can send you the data. But for the sake of keeping my presentation short, I will not bore you with the details of how we are able to do such, how our product is able to function to be a liver aid, a kidney aid, and so on and so forth. All right. So I think with that, I hope I've given you an overview, all right, and a picture of how PPARs has the potential to assist in the fight against cancer. Okay, and with that, I would move into my Q&A segment. Okay, and I already saw one question already, which is what again is the chemo drug that PPAR has been tested on? Okay, 2. Okay, cisplatin and oxaliplatin. Okay, these are the 2 most commonly used cancer drugs because they are effective for the use of more than 14 different types of cancer. So basically, almost any cancer patient would have cisplatin in his protocol. Cisplatin is also the primer for many immunotherapies, like for example, breast cancer. Before you use tongue twister, all right? Before you use immunotherapy drugs for breast cancer, they probably would undergo cisplatin first, all right? Cisplatin is also used for prostate cancer. So that's another one. It's a slow-growing cancer, so it's really great when you combine a slow-growing cancer with natural approaches. So it really gives the patient a very positive experience in their cancer fight. All right. So Ruben, or Emmer, let the questions begin.
Come. Hi everyone. This is Ruben. Actually, Sir Shyan, I'm receiving a lot of messages directly in my Viber and SMS. So right. Doctors, I'm encouraging you to send your questions here directly. Don't worry, we will address all of them.
Ask me.
So one of the questions of one of our doctors in attendance is, I think they missed the LD50 part, is they asked me, do we have an overdose with SimplyNature PPARs?
Okay, that's a good question. Why don't I jump straight to that particular one? Okay, here it is. All right. Okay, LD50 test, okay, is done as a toxicity test. You will not do this test with drugs because you will never feed a person lethal dosage of drugs. You won't just like overdose a patient, okay? But LD50 is often used for medicinal herbs and foods, but mostly for medicinal herbs, okay? So for example here, what the technical definition is defined as the dose where okay, basically you feed the test subjects. You don't do LD50 on human beings, obviously, because you don't want anyone to die, right? Okay, so you do it on lab rats. You feed a dosage until half the lab rats die. Okay, at what dosage of your food or your medicinal herb, okay, at what dosage will half the lab rats die? And for us, when we did the test, none of them died. We gave them how much, right? We gave them, okay. Here is, I give you an example, right? Now, for a cancer patient, stage 4, the highest dosage we ever recommend for any patient is 3 vials a day, 3 vials a day. We tested on the lab rats equivalent to 250 vials a day. So basically, it's 80 times more than any doctor would ever prescribe, all right? So if you take 80 times, first of all, no patient can afford to take 80 times the highest concentration. So this is just to go to show you how safe is our product, all right? So there is no overdosing, okay, for our product, all right? So, but if you are always concerned, our representatives and also researchers are always there to back you up. Okay, you can always ask us. So our relationship with our doctors that we work with us is not one of us. We are not your suppliers. Okay, we are there to be there with you to also handle your patients if you need us to. Okay, and of course we do understand you are the primary physician, and we understand the ethics involved in working with doctors and their patients. Okay, and that's why doctors are happy to work with us. We are not some direct selling company or multi-level marketing company, right? We only deal with doctors. So if you are comfortable, we are able to definitely assist you in your patients. If not, simply you can give us your patient's charts. We have doctors, physicians on our board as well, so that they can always help us interpret and give you advice, all right? So you're never alone when you are using our protocols. Okay. Now I see a lot of other questions popping up on no more. Okay, I see one. Can I immediately begin with liquid PPARs on a patient who received their second cycle of chemotherapy a few days ago? The answer is yes. It would have been ideal if the patient actually took the product before, all right? But thank goodness, if the patient's not seeing any side effects yet or see some side effects, if they take the liquid vials, they are absolutely fine, all right? Dominic in the picture actually took vitamin B7. Okay, another question about vitamin B17. All right. Okay, good. Dominic actually took his very first vial on the first day of his chemo, on the morning of his first chemotherapy session. because Dominic was a PGH charity case. So definitely once they are scheduled for chemotherapy, they don't change the date because they don't know when the next time that will be available. So he took it actually that morning, and he did very well. You saw the picture. 2 weeks later, he put on weight. He looked so rosy, like a normal kid, right? Yeah, so that's an example. Okay, Emma and Ruben will be able to assist you with the actual dosaging for your patient. Okay. I see another question. What can I say about vitamin B17? I can't say very much about vitamin B17. Okay. I want to share something with our attending physicians, right? I don't think there is one substance or item. I don't think it's a good strategy for the patient to use a mono protocol, or to think that one thing will solve and effectively fight cancer. Okay, just to give you an example, even when a surgeon cuts out the tumor successfully, even if it was a clean cut, all right, and the tumor was not very big and they were able to remove it, prudence actually suggests that the patient undergo chemotherapy, right? And the reason is very simple. It takes the doubling time for a tumor to reach a size where it can be detected by scans. It's quite long, right? But when a tumor is 2 centimeters and your doubling time is 1 month, 1 month later, 2 centimeters becomes 4 centimeters, right? So and then from 4 centimeters, it only takes 1 month to become 8 centimeters. So that at a certain stage, the doubling time becomes very lethal, right? But in the early stages, the doubling time from being undetectable and doubling to still undetectable is 1 month. So nothing basically happens to you in that 1 month. But here it is, that cancer cell will continue to grow. So even if in a successful surgery, we want to take chemotherapy to just possibly kill any cancer cells that are floating in the body system, right? So that shows us that there's no one protocol that will really solve cancer. So I'm not here tonight to say that SimplyNature PPARs alone will do its job. No, that's why we are being very realistic. And I believe that the attending doctors, you might have different strategies and protocols, for example, using B17 or not using B17 for the treatment of your patient. But what I would like to highlight is that that I would definitely encourage a more holistic approach to treating a cancer patient. What I can answer, not specific to B17, let me check something. I'm going to check just to see if SimplyNature PPARs actually contains B17. I guess not. All right. Okay. I might have to look at our more complete nutritional profile to see that. But here it is. I know what our product does. We are fantastic. We definitely facilitate the functions of the liver, the kidney. All right. We activate the pathways for modulating inflammation and metabolic pathways. So you can see how that would work. For B17, to comment on that, I would invite next time I'll invite Dr. Johnson to join me, because Dr. Johnson is a lifestyle medicine doctor. So lifestyle medicine doctors study more in depth when it comes to the application of vitamins and minerals in the treatment of cancer. So I will leave that for him to answer. All right, and I'm more confident in staying within my realms of expertise, which is the PPARs. Thank you. Okay, next, just want to start slow. What is the minimum effective dose for PPAR cancer patients in general? Okay, I think that's a very good question. It's good to start slow, but not because we want to start slow. We want to start slow just to check if the patient has a Herxheimer reaction, right? Whether the patient has, when, for example, if a patient is severely dehydrated, if you suddenly force a lot of liquid into him, he will have a reaction, right? So we just want to avoid that. But we want to, as quickly as possible, reach maximum dosage. Now, the approach to using our protocols as support for cancer is a bit different from drugs. Okay, for drugs, you know the toxicity and lethality of drugs when you go beyond your dosing. And as doctors, you know, the higher the dosage of any drug, the stronger its negative side effects are going to be. So you don't use the strongest antibiotics unless you have to, because the strongest antibiotics could sometimes even hurt the liver, right? So we don't use the strongest drugs unless we have to. Now, the reverse, the application of support, nutritional support, adjunct therapy like ours is the reverse. You actually want to go for as strong as possible. I'll give you a simple example. Let's take a look at, you know, those gym nuts. Okay, people who go to the gym and want to use okay. For example, when a gym person uses creatine, okay, to be able to work their muscles over time. Okay, what they do in the initial period is to do overload. Why? Because the body's creatine level naturally based on your diet is probably going to be low. So what you want to do is you want to take lots of creatine until it reaches the maximum level that your body can hold. Now, after you take more than what your body can hold, literally every mg of creatine that you eat after that ends up in your urine. All right. So this explains why, I don't know for the doctors in attendance, do you notice that if you take those mega multivitamin pills that you buy from the like GNC, those mega multivitamin pills, do you realize that your urine is bright yellow in color, right? And that is because once your body absorbs the maximum amount of any nutrients, any surplus will just be dispensed out of the body. Okay, so using that understanding, what you want to do for natural products, nutritional support, is to quickly top up whatever the body's lacking. Right, your body may be lacking in, let's say, zinc. All right, so cannot use vitamin C because you don't have zinc. All right, so you want to basically top up to what your body can hold, so that whatever other nutrients that you take in, the body can use and synthesize it to do what it's supposed to do. Right, so for natural products, you actually want to go on a high dosage as quickly as possible, and then after that taper it down, because once your body's at maximum, there's no point taking any more extra. It just can't use, it just can't absorb. Okay, now, but you are right, you want to start slow first, just in case the patient's body is very weak. You don't want to shock it, right? You don't want to shock it with overnutrition immediately. So my recommendation is always that when you start slow, you start with a minimum dosage of 1 vial a day if the patient is serious enough that you need to use liquid vials. Okay, and then you bump it up as they get acclimatized to it. Okay, now for powder extracts, it will probably be 1 scoop on the first day, 2 scoops on the second, and then increase up to the protocol's requirements. It could be 2 scoops twice a day or 3 times a day, depending on the seriousness of the patient. You can start slow, the first day with 1 scoop, second day with 2 scoops, but we want to try to, as rapidly as possible, reach maximum dosage. And then after that, we can taper off. So once the patient has good results, you can taper it downwards. If the results start to slide because the patient's the momentum is not there yet, then you bring the dosage back up to the higher dosage, right? So it's something that we can monitor, and because we've done our LD50 tests, you don't really worry that the patient is overdosing. Whatever they don't absorb, it will come out in your urine. Okay.
So for our next question, Mr. Sean, I actually received similar messages from our pediatricians in attendance. Is PPARs okay with all ages, especially for infants?
Yes, it is. In fact, please, for Ruben, please send to these doctors who ask this question, Dr. Johnson's patient. We have an attending physician that works very closely with us. His name is Dr. Johnson. He's a lifestyle medicine medical doctor, and he specializes in supporting cancer patients. So he has actually a baby toddler, infant, baby GN, all right? Baby GN was taking I think, our liquid extract, our most concentrated extract. And it was really good because he avoided brain surgery, and also he was able to go through his chemotherapy with no side effects. And he was able to have reduced cycles of chemotherapy, which his uncle was also very happy. You know, when you see such a beautiful and cute baby, you also worry. You also worry, right? So it was really a good news for everyone. And baby Gian today is cancer-free. So I think what you can do is, Ruben, you can send the video, and if the doctor needs any more details, simply ask Dr. Johnson for permission to share details. So no, there is no age limit, both young and old, for the use of our products.
Okay, thank you very much, sir. Okay, they messaged me that they appreciate that we address this concern, so they're
Okay.
very glad.
Yeah.
That we don't
And
have
personally, in my family, my niece, when she was 4 years old, she took out my product because she had a growth on her lip, and she avoided surgery for that. Yeah, the growth actually just went away by itself because, you know, especially for kids, the immune system actually is pretty effective for addressing any tumor growths or wrong developments. Yeah.
Okay, so another common question that I'm receiving, and please, doctors, I encourage you to put your questions in here in our
It's
Q&A
okay.
in
Let them
Zoom.
fiber you. Let
Okay.
them fiber you.
Okay.
Let them fiber you.
So one common question here in my inbox is, how long should I take the SimplyNature PPARs, and what's the protocol for cancer?
Okay, I think this will be better addressed if you arrange for a one-on-one with Ruben and Emmer. I mean, that's their job to support you. But I'm going to give you an example, all right? Imagine patient has 4th stage breast cancer metastasized to the bone. Came to you already 4th stage metastasized to the bone. So what do you do, right? So if most likely you want to slow down the cancer so that the patient has a fighting chance. So it's very difficult not to recommend chemotherapy, all right? So the patient is probably already very weak. So what the standard protocol will be, 1 liquid vial a day, all right, to prep the patient to be strong and to also protect the patient while they're undergoing chemotherapy in this weak state, right? Because definitely when you're so weak and you take chemotherapy, your RBCs and WBCs might plummet, all right? So at this point, that's what we did. And this actually happened to one of our clients. The client was bedridden. Within about a week from being bedridden, the client was able to walk around down. That's a huge improvement. That has got nothing to do with curing the cancer, all right? Right, so walking around, from bedridden to walking around, is not talking about a cancer being cured. It's just simply talking about the body's other organ functions, right, regaining its traction, that the patient is able to displace the kidney, the liver is working properly, whatever food, their appetite came back, whatever food they're taking is being assimilated, and they're feeling more energetic and strong enough to stand, right, from bedridden to stand. Obviously, if you are bedridden to being able to stand, you are in a better condition to go for your oncological protocols, from surgery to chemotherapy, okay? So what happened was that this patient finished her chemotherapy sessions, right? And then what did she do? She continued to take the extracts. She went down from liquid to powder because it's financially more sustainable. And she kept on it in order to recover, right? So after she recovered, then what she is on will be soft gels, and then slowly move down to the tablets. So today, for example, Dominic has been cancer-free for, I think, 4 years now, right? Dominic takes the powder extract, I think, once every 2 months, something like that. But he's basically on the tablets, all right? So you can see it's a movement from liquid, the concentrates, and once the cancer markers are back down to normal, you move to a maintenance stage, all right? So the maintenance stage is a combination of soft gel capsules and tablets. The final maintenance stage is just the tablets, all right? Again, your body's momentum is there, is recovered. The immune system is recovered. So you're basically taking the SimplyNature PPAR tablets as general superfood nutrition to keep your body going, to make sure you are not missing any vitamins. And of course, there is a trace amount of PPAR agonists even in the tablets. All right, and that will be sufficient to keep your PPAR receptors continuing, because they are already activated, right? They're already activated. As long as you continually have a residual amount of PPAR agonists, it will stay activated. So that's how it is. So what it really means is that for the oncos and for those who support, who treat patients with our product, the patient will be with you for 5 years at least. All right, and then after that, they will still be with you on tablets, probably for the rest of their lives. Why? Not because they have to as a maintenance, but it's definitely something that they will enjoy and is the best option for them, right? It's the best anti-cancer supplement they can get because they got well from cancer on it. So as long as they keep taking it, yeah, they're gonna have good results. And I wonder if I have this picture. Oh, I don't have the picture. Let me see. Okay, I'm going to try and find I'm gonna try and find this one. Okay, guys, I just want to share with you. Okay, let me see. Okay, let's see if this is the one. Okay. I just want to share with you why your patient will be with you long term and why this is one of the best things that could probably happen to your practice. Your patient will be with you for a long time, okay? And here is the picture I want to show you. Ruben, I can't see the screen, but is it the full picture? Can you? Ruben? I can't hear you, Ruben. You are muted.
Hi, sir. So
yeah.
are you showing the whole food?
No, okay.
Presentation.
Okay, then let me change the presentation. All right. I want to show you guys this one. Look at this. Okay.
Sir, we can see now.
Okay. This is not updated. Okay, but here you have my niece who's a baby, my niece who's a kid, my niece who's a bigger kid, my niece when she was a teenager, and my niece now who's in Polytechnic. Okay, you can see this is me in 2006, 2015, 2016, 2018, and you can see right now on your screen me 2022. I am not just sharing PPARs. I take 20 micro tablets every day, and I'm going to share with you the final benefit is anti-aging, okay? Because it supports healthy liver function, kidney function, lung function, and all these things. So that's why it's anti-aging. It controls inflammation. So obviously, if you control inflammation, it has an antioxidant function. And there you go, all right? This is the best proof of anti-aging. 2006 picture and 2022 picture, no filter. Okay, it is not Photoshop. All right, so yeah, some light-hearted example of your patients being with you for a long time. They don't have to take SimplyNature PPAR tablets just for cancer. They are taking it to stay healthy, metabolic syndromes being kept away, and of course the final thing being energetic and anti-aging. Right.
Wow, you really didn't age, Sir Shyan. So I
I've
think
got to walk or talk, right? Yeah.
Yeah. So I think it answered one of the question here in our Q&A. What makes SimplyNature PPARs different from other supplements? One of that is this. So
yeah,
Sir Shyan
correct.
didn't age at all.
Yes, so you will see many of the cancer patients actually have a reason to continue with your relationship with you, their physician. So they can come back for their annual checkups, maybe do diagnostics to see their cancer markers on an annual basis. At the same time, they will still continue to be your patients for PPAR tablets because it helps maintain the rest of their health, right? Is PPAR available in pharmacies and drugstores? No, it is not. At one point, we were being distributed by Pasquale. Then, of course, the combination of pandemic and everything, we have now streamlined our distribution to 2 doctors directly and our only company official store on online platforms like Lazada. The reason we make our products available on Lazada is to provide a reference point for all your patients, right? So that your patients, when you tell them this is the price of the tablet, they can go online and check, and they will realize, whoa, it really is this price. Okay, because we don't have a mercury drug to compare to, so we decided that company itself will have one official store so that your clients and your patients can do a price check. And there is always a slight discount when it comes to doctor's price. What I meant is that for doctors, you will be able to sell your products to your patients at a slight discount. So they will always prefer to get it from you rather than Lazada. Yeah.
And for the search, I just want to let our doctors know, because there's a lot of doctors chatting us directly, sending messages about the special price. First, we cannot disclose it right now, but see to it that after this event, we're going to send it to you to your email regarding your concern or your questions about our doctor's price or special price.
Oh, yes, of course. For all the doctors and physicians, we have, obviously, we work and distribute through doctors. So there will be a wholesale price for doctors who take inventory. And there will be other modes of ways you can work with us. Simply chat with Emmer and Emerson and Mr. Reinberg, Ruben, all right, and see which option works best for you.
Yeah, and you can see here our contact number to all new doctors.
Oh, Ruben, you are in Barong, huh? Okay.
Yes, sir.
All right.
For our new guests here, because Sir Shyan, there's a lot of new doctors, new names and faces that we saw right now. Kindly save this contact number so we can give all the details that you need.
Okay. Once again, we only distribute through doctors and our online stores. And you will find that you can search the whole internet. There is no listing of price except for the standard retail price on our online Lazada stores, right? So that's how we protect our doctors. That's how we make it exclusive for our doctors.
And I also want to say that please be careful. There's a lot of copycat and fake, something like that in internet. So please be careful. You will only get the right price and original products or authentic products from us, me and Ruben, and this company only, SimplyNature.
Yeah. Okay. This is a very Philippine phenomenon, right? Once something becomes popular, like I think at some point, what's that? What's the thing that skin white? Glutathione, right? Once one glutathione product starts to hit the market, like 20 glutathione products starts to hit the market. The good news I want to share with everybody is our products are unique and we are exclusive for Philippines. All right, we especially our PPAR extracts, we are exclusive for Philippines. So that if you ever see another one, most likely I would be very careful, all right, because number one, we are dealing with cancer patients. So whatever is cheap is probably not real.
Yeah, and we really receive a lot of complaints about these other companies. By the way, Sir Shyan, thank you for your time, and to all our doctors, thank you everyone who has joined for us.
Oh yes, it's 9 o'clock already. Thank you. Nobody dropped. We still have so many doctors. Yeah. All right.
So we're really very grateful for your participation, and I want to call once again Ruben Reinberg.
Hello, doctors. This is Ruben Reinberg. I hope you remember me, as it's my first time joining this doctors forum with you guys, and I'm really glad that we get a lot of positive response for this doctors forum. So now, Mr. Shyan and Mr. Emerson, thank you very much for allowing me to participate with this one.
Once again, my last note is to the doctora who asked about the B17. I think what I will do is that I will compile a comment. I'll talk to Dr. Johnson about this and I will get back to you. All right. It's a common practice here at SimplyNature that when our doctors ask us something, we would actually follow up on it. Okay. So, but give us some time to make sure that my response to you will be one that is evidence-based. I'm just not confident talking about it off the cuff of my cuff tonight, okay? Because that's not my area of expertise. Yeah.
So again, thank you very much, everyone, and thank you, doctors, all the way from PGH, UST Hospital, West Visayas Medical. Oh my gosh, there's so many hospitals, and we have also in attendance prestigious organizations such as Prima and PCLM. So hi everyone. Hi, doctors.
Hi, doctors. Yeah, also hi, Doc Alvin. And we still have a lot of doctors from provinces. Don't worry, we're going to reach you and we're going to serve you all your questions. Just send it to us. Okay, Ruben.
Okay, so thank you everyone for joining us, and please stand by. We have a certain survey after this doctors forum, and we hope to see you again soon. So we will I will inform you, doctors, and all of here in attendance. I will inform you guys in advance when our next doctors forum will be. So don't worry, I'll be in touch with all of you, doctors, and again, thank you very much for your time.
Thank you.